Hi everyone, my name is Madison and today I'm going to be talking about my project addressing the health literacy deficit. Can integrating personality traits improve healthcare decisions? This is some background about our project. So there is a relationship between economics and personality psychology. Health literacy can impact health insurance decisions, and health literacy basically just talks about how much information a person knows and how well they know that information regarding health insurance plans and other things that go on within the health, like the health and medical industry. Personality can also impact health-related behaviors, and this can be best seen in the Term and Longevity Project, which is a 70-plus year project that looks at the lives of different individuals from the time they were little until the time when the project was concluded or until they died. This looked at how their personality impacted who they were as people, how their personality impacted their health, and so on. These were our 4 big research questions. Our first question was, do Big 5 personality traits correlate with an individual's health behaviors? And we specifically looked at how many times they visited a primary care doctor, how many times they visited a mental health professional, how many times they went to a dentist, and how often they accessed emergency room care, how often they participated in physical activity, and how their diet was. Our second question was, do demographic characteristics such as age, gender, income, number of children, health status impact an individual's decisions regarding the choice between health insurance plans? Our third question was, do Big 5 personality traits impact an individual's decisions regarding the choice between health insurance plans? And our final question is, which health insurance attributes are most important to individuals when deciding to adopt an insurance plan? This table shows the Big 5 personality traits as well as their characteristics. So a person who is more extroverted tends to be assertive, talkative, sociable, and active. Somebody who is agreeable is modest, cooperative, good-natured, compliant, and gentle. Someone who is conscientious is responsible, careful, thorough, and organized. Someone who tends to be more neurotic, they are insecure, angry, depressed, and have anxiety. And people who are open to new experiences are oftentimes open-minded, sensitive, intellectual, and imaginative. So our survey was disseminated through Amazon Mechanical Turk, and we had a total of 432 individuals take our survey, most of whom were from the United States, and we had a couple people from other countries take the survey as well. Unfortunately, we had to omit their answers because their health insurance setup is different than the United States health insurance. We also had to omit answers that were out of the ordinary. So, for example, one of our participants listed that they had 5,000 children. So that was a little weird. So we omitted anything that was out of the ordinary, kind of like that. And our survey has 6 different sections, which include demographics, such as where your zip code is, health history. So kind of like, do you have a history of high blood pressure in your family, and so on. Health behaviors such as how many times you went to the doctor. Influencing factors such as do your coworkers, family, friends, doctors influence how you choose health insurance? The Big 5 personality score, which was a 10-question score, and people had to rate themselves on a 7-point scale with how much they agreed with specific statements. And then the choice experiment, where they had to choose between health insurance plan A, health insurance plan B, or no health insurance plan at all. So the multilinear Varia regression was our first regression that we ran. So this shows the regression results from our 6 different regressions. The table has p-values that are shown at the 0.05 significance level, and the variables with a little star are positively impacted by income. And the multivariate linear regression for us deals with the coefficients that measure the impact of a 1-unit increase in personality trait measures on health-related behaviors. So you can read the table like this. With a 1-unit increase in extroversion, while holding all other independent variables, which were the big 5 personality traits, constant in this row, it would impact physical activity by a rate of 0.060. And similarly, with a 1-unit increase in conscientiousness, while holding all other independent variables within that row constant, it would impact emergency room care by a rate of negative 0.445. One of the next types of regression we did was the conditional logit model. And this model includes alternative specific variables such as price and value attributes of each insurance plan alternative. This table is also derived from different conditional logit regressions where the model runs on case-specific variables or regressors which are unique to each participant, which includes demographics and personality. So we ran this one, I believe, 3 times, and each time our dependent variable was the health insurance plan choice, and our independent variables worked with demographics, personality, and health insurance plan attributes. You can read our table kind of like this. So if it has a negative, the person is less likely to choose a plan relative to the no option. And if it has a plus sign, the person is more likely to choose a plan relative to the no option. So the ones with negatives were age, neuroticism, and premium. And the ones that had a positive sign were health status and extroversion. So, for example, for health status, a person who perceived themselves to be healthier were more likely to choose Plan A or Plan B compared to the no option. And someone who viewed themselves as being more neurotic was less likely to choose Plan A or Plan B relative to the no option. And the premium, health insurance premium, is significant at the 0.05 level, while the other variables such as age, health status, extroversion, and neuroticism are all approaching significance at the 0.10 level. So these are some of the results from our study. So we found that big 5 personality traits do impact health-related behaviors, and this can be seen in Table 2, which was the multivariate linear regressions that we did. And then age and health status impact an individual's choice of health insurance plans, and that can be seen on the conditional logit regression table from the previous slide. We also found that extroversion can affect an individual's preferences for health insurance plan attributes, and this is seen on both Table 2 and Table 3. And premiums are the most important attribute to individuals when choosing a health insurance plan, and this can be seen on the previous slide as well. So for future studies, we feel that there would be more studies needed to further expand on the relationship between health insurance decisions and personality traits. And with that being said, more research could prompt a reform within the health insurance industry, where health insurance companies tailor health insurance plans to individuals and their personality traits, rather than making plans that are supposed to be suited for a wide range of individuals. I have a reference page here, and it's a hyperlink to a Google Doc. If you would like the reference page, you can email me, and I will be happy to send you a link, or you can use the hyperlink to access it. Thank you.